Welcome back to the Gut Health Dialogues. Today, I'm thrilled to welcome Julia Chien to the show. Julia is a Vancouver-based registered dietitian who specializes in gut health, eczema, chronic inflammation, and the mind-body connection. She's the founder of a holistic practice that empowers individuals to heal naturally by addressing the root causes of their symptoms. Sound familiar? That's what I do as well, except her focus is more specifically towards skin issues. And her approach is deeply personal. After overcoming her own battle with severe eczema and topical steroid withdrawal, she committed herself to helping others navigate similar challenges. Through her one-on-one coaching, online courses, and her podcast, The Eczema Warrior, she's guided countless clients towards symptom-free, vibrant lives by integrating functional nutrition, lifestyle changes, and mindset work. And today we'll be diving into the concept of the gut-skin axis, how our digestive health and skin are intimately connected, and exploring how inflammation, stress, and emotional well-being all play a role in healing. So, welcome, Julia.
Thank you. I'm so excited to chat today.
Yeah, so we both kind of work in gut health because you can't really separate one part of the body from the other, but your practice focuses mostly on skin. So I thought maybe we could start by explaining what is the gut skin axis? What does that actually mean, and what is that connection?
Yeah, so your gut and skin are in constant communication, similarly to the gut brain connection, where your gut is connected to your brain. So is the connection between your gut and your skin. So when there is an imbalance in your gut, or if there's inflammation going on in the gut related to other root causes, it can show up in the skin as eczema as well as other inflammatory skin conditions. When we want to heal our skin, if you have eczema, we want to start addressing the gut because they go hand in hand.
Yeah, I totally agree because the gut and skin are both barrier systems. They both have their own microbiomes, they both interact with the immune system. And so when the gut barrier gets permeable and inflamed, it can trigger issues all over the body, right?
Exactly. When the gut's inflamed, then so is your skin. I always say, like, your skin is a mirror of what is going on in the gut. So if you've got lots of inflammation, that tells us that there's definitely some sort of inflammation happening inside the body.
And is inflammation the main driver there, or do you see nutrient deficiencies also that might originate in the gut playing a role?
Absolutely. A lot of people with eczema have nutrient deficiencies. A lot of it is our food nowadays aren't as nutrient dense as it used to be. So it's actually quite difficult to get all the nutrients that we need, especially when you have inflammation in the skin. For example, there's a lot of research nowadays that talk about vitamin D deficiency in patients with eczema. So vitamin D deficiency is very common across the world. So that's one example of a nutrient deficiency that we see in practice.
Yeah, so that's interesting with vitamin D because we get it through sun exposure and we're trying to protect our skin so we don't go out in the sun and we wear sunscreen, but then we get deficient and more prone to eczema.
Yeah, and then a lot of us, I guess people who work remote or we're at our office all day, we don't really need to go out as much. So for me at least, like I feel like I'm always stuck at my desk. So we really have to be intentional with going outside and getting that sunlight exposure.
Yeah, absolutely. So if somebody's experiencing eczema, what are some of the common underlying drivers that you see in clients with chronic eczema, especially when they've tried creams and topical treatments and they're still not seeing results?
So with eczema, there's actually a combination of root causes. Typically, we see a combination of about 3 to 4 root causes. And I would say the most common root cause, surprisingly for a lot of people, is actually stress. Stress is a big root cause for eczema, and it's also one of the most hardest root causes, I feel like, for people to heal from, because we're so exposed to stress every day. We're in that autopilot mode. But that is probably the number one root cause that we see in practice. And then, of course, when you have chronic stress going on in the body, it's going to affect the gut because of the gut brain connections. Then we see stress as the root cause, and then it affects the gut lining. It creates more opportunity for gut infections like Candida, SIBO, which I know you talk about in your podcast as well. So then that also becomes a root cause for eczema. So there's the stress component, then there's gut infections like Candida and SIBO, dysbiosis in the gut. So I would say those are the two common most root causes. And then nutrient deficiencies as well, we see.
So it's almost like I'm picturing like a cycle, right? Because it's not like we're saying, okay, if you can calm down, your skin's going to clear up. It's that stress is a component that then affects the gut's immune system, that then affects the microbes in the gut, that then triggers inflammation, and it becomes this, and that then also affects our nutrient absorption. So it becomes like this vicious cycle of all of these components, right? Or multiple components. Yeah.
Yeah, that's why as practitioners, we're looking at all the systems, right? We're not just focusing on just diet or just stress. It's like the whole picture, which is really important because I don't know if you notice this in your practice, but a lot of my patients that come to me, they come from being on very restrictive diets and avoiding a lot of foods. And that was what they learned, I don't know, from social media or from whoever, to just restrict their food to hope for results. But that hardly ever happens because there's, again, other components that we need to look at.
Yeah. Oh, I absolutely see that. I actually experienced that personally early on in my journey working with digestive health. I had all this stress leaving my steady job to start a private practice, and I was starting in a new specialty. So I have this learning curve of the new specialty, all this pressure, all this stress, and I developed acid reflux. From the stress. So my gut was out of whack, and I started avoiding foods to try to manage it. And I was just in the same shoes as many of my patients, feeling, okay, I'm just further and further whittling away my safe food list. And this can't be the answer, that I just suddenly can't eat foods. Because that's a really depressing place to be. And that's where a lot of people end up. And so then you have to back up and say, okay, I thought the food was the root cause, but there's got to be some reason that I could eat these foods my whole life and now suddenly they're causing problems. And it's because your digestive system has changed, and it can change back. It can get healthy again, just like it once was.
Yeah, and that's amazing that you share that because I think with my patients, they think that they're not able to get back to that point again because they've fixated on the diet piece. It's, oh, I can't eat this food now. That means I can't eat that forever. But like you mentioned, something changed, right? For your digestive system to not be able to tolerate these foods that you used to tolerate. So it's then figuring out what that is. Did you have more intestinal permeability over the years because of stress? How can we heal that through nutrition and supplements and things like that? So looking deeper into those aspects.
Yeah, absolutely. And I always think it's interesting to talk to other dietitians like you that do similar work to me, because we may have different specialties. Yours is skin, mine is IBS and SIBO, someone else, it might be acid reflux, but we're actually doing very similar work with people. We're getting the gut healthy, we're rebalancing the gut, we're repairing the gut lining, we're calming inflammation, we're resolving absorption issues. Like, we're doing the same work because the gut really is at the root of so many issues. We can have two patients walk through the door with completely different symptoms, and it can all boil down to, maybe, and everybody's different, but it could be a very similar protocol that both of them are on to resolve their symptoms.
Yeah, and then I have patients with eczema who have SIBO and gut symptoms. I don't know if you do notice it with your patients too, like maybe they have a little bit of eczema because it's all connected. So
Yeah, absolutely. They have a whole gamut of problems, but what they walk in the door, that's what's bothering them the most, might be, for me, the bloating. That's why they came to me. For you, it might be the eczema that's bothering them the most because it's all over their skin, all over their face. And so, yeah. I think diet adjustments do have their place. Certainly in the short term, it can be helpful to calm things down. But I believe that elimination diets and avoiding food sensitivity should be a step in the approach, and that you should move past it as soon as you can and calm things down and reintroduce the foods. Because I remember one woman, she had not eczema, but cystic acne for a long time. It was all over her face. She was a professional woman. She was very troubled by it. And we actually did an MRT, food sensitivity test. This was years ago, and found out that she had sensitivities to foods that you would just never think. Let's see, like mushrooms, blueberries, green tea, just stuff that like was totally random. And when she eliminated those foods, it was like a miracle. Her skin cleared up. Do you want to explain, maybe we should talk about like how that happens and why it can seem like that's the solution, but how do food sensitivities occur?
Yeah, so food sensitivities with eczema occur for, I would say, two main reasons. Number one, you actually have a food sensitivity, and maybe it's something that you didn't know because you've always had that type of food in your diet and you only figured it out once you've done a short-term elimination diet. And then when you figure out that you actually have a sensitivity, then that's possibly something you have to avoid for possibly indefinitely, especially if it's like an actual sensitivity. The other reason is you develop the sensitivity over time, and that could be rooted in your, again, going back to your gut being inflamed because you have intestinal permeability from a different root cause, whether that's stress causing that in the gut, or you have some type of overgrowth in the gut that caused your gut lining to become leaky. And when that happens, when your gut lining is leaky, when you eat certain foods, instead of it being digested and absorbed for your body to use as nutrients, the food particles end up leaking into your bloodstream, and it causes this sort of systemic inflammation that can show up as eczema. In those cases, you can heal that. So you work on healing the gut lining, you address your root causes, you get rid of the infections, and then over time, you start to notice that you can actually tolerate those foods that you weren't able to tolerate before. So I have a couple clients actually, or a few clients that experience this. So they used to have problems with gluten, and whenever they ate even a little bit of it, they would have flare ups. After doing some of that work, healing the body inside out, they've noticed that their sensitivities significantly reduced. So I can think that tells us a lot in terms of how you can actually heal your food sensitivities once you figure out what's driving that in the first place.
Yeah, absolutely. That was really great how you explained how food sensitivities happen in the gut. So, with these situations, yeah, you'll feel better initially from avoiding gluten or avoiding the food sensitivities. But what can happen is they can just keep perpetuating. You can keep getting more because the gut is still permeable, the gut is still inflamed. So, we want to do a longer term fix, not just a patch, right? And heal the gut so that we don't keep developing more and more sensitivities. And so we have a real fix. So, are there any myths about eczema or food sensitivities that you would like to dispel?
The number one myth for eczema is thinking that using topicals will heal it. And I think as someone who has eczema myself, that was something that was a belief because unfortunately when I used to go to the doctor and the dermatologist, that's what they would tell you, right? That the only way to keep your eczema away is to slather on topical steroids. That was the only way. There's no discussion around your nutrition, your lifestyle, addressing your root causes. And as patients, even though we want to believe that you can heal it holistically, we've been told for so many years that you can't. So that's the myth when it comes to addressing eczema, is thinking that if you just put on a cream, it'll just go away. That's just a band-aid solution at the end of the day. While there's a time and place, obviously, if it's really out of control and nothing is working, we can use topical steroids for the short term to help mitigate the symptoms, but it's not a long-term solution. And then in terms of food, there's also going back to the elimination diet and food restriction. It's a lot of people think that when you restrict your food, if you avoid gluten, if you avoid dairy, then your eczema is going to clear. And while some people do see complete clearing of their eczema, avoiding some foods, I personally have seen in practice that it doesn't work that way. Food is obviously really important to our bodies, and we need to eat properly, try to have a nutrient dense diet, but it's not often the end all be all, right? It's like you change your diet and your skin's going to heal. If it was that easy, then, you know, people wouldn't have all of these chronic conditions that seem to continue on even with diet changes.
Yeah, I totally agree. And I think what I've noticed with that is people will see it at best temporary results, but then now suddenly the food that was okay, now suddenly that's causing issues, and they're just chasing new food sensitivities, and there's more and more over time.
Exactly. Different diets, changing them every month.
Yeah, it's
Stressful. Yeah.
whack-a-mole. They're just like, okay, this sensitivity, that sensitivity.
Yes.
It gets
Great way to
chaotic.
describe it. Yeah.
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 Let's talk a little bit about histamine intolerance. You mentioned candida. Even with SIBO, we see histamine. I see histamine intolerance a lot in my practice. And do you see that as well?
I do. So I do see some patients that have histamine intolerance. I would say, based on what I've seen in my practice, it's not as common as maybe we were told by dermatologists and doctors, for example. Like sometimes people say that if you have eczema, then you definitely have a histamine intolerance because you're itching and you're scratching. So that definitely means you have an intolerance, but that's not necessarily the case because in with histamine intolerance, we also look at the whole picture as well. Are you experiencing hives? Are you itching a lot? Because that releases histamines. But then also, are you reacting to certain high histamine foods? And from there, then we're assessing the body and we're seeing if the picture is showing us that this patient has histamine intolerance or not.
Yeah. Okay. So maybe that's something that's over exaggerated in the eczema world is histamine, and it's much more than that, usually. Yes. Interesting. Did you want to talk more? We touched on this initially, the impact of how stress actually, what it does, what the mechanism is, by how stress can contribute to eczema.
Yeah, this is a huge one. Huge one. Eczema is a highly emotional condition. What I mean by that is that a lot of the times that I've seen with people with eczema, they have a lot of underlying stress going on that is showing up as inflammation in the skin. When we think of stress, we think of, okay, work stress, relationship stress, the day to day stress. But I've seen that it's much more than that. It's more than just like the daily stress that we experience because eczema is like, it shows up on your skin, right? So it's the first thing people see. And so our confidence can really be dictated from how our skin looks. And low self confidence and low self esteem is very common in people with eczema. The connection with that is that how we feel about ourselves with our skin can show up as a flare. So if we don't feel good about how we look because of our eczema, the eczema can actually appear more. And then with eczema, because it's such a physical and mental condition, when we're constantly thinking about our skin, like obsessing over it, looking at it, wondering if someone else is looking at it, it makes the situation worse. And we get in this cycle of overthinking and stressing, and that raises your cortisol levels and you're worrying, and it creates a cycle of your mind affecting your skin, and then your skin affecting your mind, and then your mind affecting your gut because everything is all related. And that creates more inflammation in the body. Yeah. I feel like there's so much more to say to that, but
And also because stress interferes with the immune system. And so it can send the immune system out of whack. So, yeah, it's just closely tied with inflammation, and then it also pinches off that vagus nerve connection between the gut and the brain, so you're not getting those messages to digest your food properly, and so then it's just part of this vicious cycle. Then food is more undigested, which can cause more imbalance of microbes, more inflammation. So it's a whole cycle, as we've been talking about.
Yeah, the gut brain connection and the gut skin connection and all of it.
Yeah. What do you think is the risk then of just relying on topicals? Because that's how our medical system is, right? It's here's your medicine. That's all you need to do.
I have a lot to say about this. Topical steroids are the most prescribed medication to treat eczema. And there's something called topical steroid withdrawal. It's basically a condition where your skin becomes addicted to topical steroids. It could also be oral steroids as well, prednisone, for example. And what happens is that if you use topical steroids for a long period of time and you stop using it, symptoms come back 20 times, 30 times worse. It is very debilitating. A lot of patients with eczema go through TSW, which is the acronym for topical steroid withdrawal. And it's because of the long-term use of steroids that us as patients, we were not told, some of us were not told that there are side effects with topical steroids if you use them for too long. But yeah, there's a huge risk with using topical steroids for a long period of time because you go through topical steroid withdrawal, which is a very difficult condition because it's separate from eczema at that point.
Can you talk a little bit more about what that looks like? You said it's 10 times worse.
Yeah. So, what steroids do is that it suppresses inflammation, right? And when it's been doing that for you for years to control your eczema and you take that away, your body has no idea how to control inflammation because it's had that external cortisol to help suppress the inflammation. So, once you take that away, your body gets out of control in terms of how to control its eczema. And the symptoms are severe redness, that's full body for a lot of people, severe flaking, oozing. People start to notice ooze coming out of their skin, swelling, edema. You lose your hair for some people. It affects your whole body, like your hormones, your digestion gets off, your skin gets out of control. It's like a withdrawal from a drug. That's
Yeah, it almost reminds me of the opiate like thing, how opiates were overprescribed and then all these people didn't realize and got addicted and how awful that is. It sounds like a similar thing.
Yeah, definitely. I would say that would be the best way to describe how severe it could be when you come off of medication.
Yeah, and that sounds like that would be just a nightmare for somebody who's already struggling with eczema.
Yeah, yeah. There's a lot of awareness nowadays compared to before. Like when I went through it back in 2015, I had no idea what was going on with my skin. I thought it was just severe eczema. And now, 10 years later, being healed from it completely, and I'm very grateful for that. There's more awareness about what topical steroid withdrawal is because it needs to be known in the medical community that it's not okay to be on topical steroids for too long because this is literally what can happen. And there's studies now and there's patient cases of people's skin just out of control.
Okay, so do you see providers using those more carefully now, or are they still widely prescribed?
It's still widely prescribed. Unfortunately, not all practitioners are open to accepting what topical steroid withdrawal is. That's something that the practitioners that are aware of are trying to bring more awareness to. So it's a work in progress, I would say.
Yeah, yeah, absolutely. And thank you for the tie-in because I do want to hear about your story and how you got into this. I probably should have asked you that initially, but can you tell us a little bit about your experience?
With my eczema journey. So I was born with eczema. It's interesting because I don't really remember my skin when I was a baby, but my mom like had pictures of me when I was a baby, and then I could literally see the eczema patches like on my face and like everywhere. And I was always allergic to her breast milk for some reason. So actually, I wasn't breastfed for very long when I was younger, which is interesting because when you're breastfed, obviously your immune system is better. And I had eczema since I was a baby. And I remember growing up in my teenage years that I would be using a lot of topical steroids prescribed by my dermatologist. And I was on clobetasol, which is the most potent type of topical steroid. And I used that for 10 to 15 years. Didn't know what TSW was. My eczema would come and go, and I would just use it whenever I needed to use it. And then in 2015, when I was interested in becoming a dietitian at that point, I was seeing a naturopath and I wanted a natural solution to treating my eczema because I was so tired of carrying my steroid around every day. And then she was like, "Oh, have you ever thought about not using your steroid and just trying to heal your gut and do the things that I've been doing right now to help with my clients?" And I was like, "No." So then I started to work on my healing in 2015, went off of steroids by my own choice, and then experienced this horrific withdrawal that lasted a few years with the symptoms that I shared. And then I took a lot of guesswork and trial and error to figure out how to really heal this condition. And there isn't a one protocol that you can just heal from because it's a drug withdrawal. You kind of have to let it purge. So it did take a few years for me to recover from that. But now I no longer go through TSW. I just have eczema, and that's managed through lifestyle and knowing my body and my triggers. Yeah, that's a bit about my journey. Sorry, it's a little long.
That's okay. And what you just said, I think that's what people are wondering right now. If I were listening, I'd be thinking, okay, what's the plan? How do I get rid of it? What do I need to do? What are the steps? But I know with the issues I deal with, everybody's gut, everybody's body is like a fingerprint. And there's some common issues that can contribute, but everybody's puzzle is going to look a little different. Is that what you notice with eczema?
Exactly. Yes, everyone's body is very unique and different. What works for one patient might not work for the other, which is why, as practitioners, really getting to know someone's medical history, their nutrition, doing that clinical assessment can help guide us in creating a protocol that is more personalized for sure.
So that's what you do with your one-on-one clients. You do testing, anything like that. Can you tell us a little bit about your approach?
Yeah, so I do testing. So I've been new to the GI map world. So I'm in the process of learning more about that. But stool testing for patients, looking at what's going on inside the gut. We look at labs because nutrient deficiencies are quite common in eczema patients, actually, patients in general. So we're looking at if they're deficient in vitamin D, B12, iron, things like that, and then addressing those deficiencies through food and supplements. And then, of course, the medical history is super important. So, one of the first things I like to ask for people with eczema is their steroid use, because a lot of times people don't know that they might possibly be going through TSW. So, I always like to ask that question about their medication use over the years, because that really changes the direction of the treatment plan for someone who has eczema versus TSW or both.
Hmm, interesting. And what are some of the other ways other than one-on-one that people can work with you?
So right now, I just do one-on-one. I used to do group in the past, but we've transitioned back to one-on-one. I do one-on-one coaching, so that's for people who want that longer-term support and accountability. And then I do one-on-one sessions in the package style for people who maybe less symptoms and don't need that kind of longer-term coaching.
Yeah, I'm with you. I actually tried to do group as well. And because of what we're talking about, how everybody's so different, I just wasn't able to make it work because I'm used to being able to really personalize things and deliver results. And it's just hard to personalize in a group setting, I found. So I also am back to just one on one.
Yeah, I know a lot of practitioners do group coaching, and I've done it for quite a period of time, maybe 2 years, and it worked well, I would say. But again, like, the personalization is a little bit difficult. Like, everyone just had, like, their own general protocol, and then you would answer their questions in a group setting. So I guess it just depends on the patient. Like, some people are okay with just that, and they do very well. Others need a little bit of that hand holding.
Yeah, we're about ready to wrap up, but is there maybe one tip or anything anyone could maybe start today if they're experiencing eczema?
I would say start looking into the gut. And if you're working on this on your own, see if you can find like a connection between your gut and your skin. If you have symptoms in the gut and you also have eczema, then starting there, can you work on changing your diet or taking a few supplements and just doing that gut healing work and starting from there? If you're new to the eczema world and you want the first steps to addressing your eczema.
Yeah, because a lot of these issues are the microbiome. So that means you could have an overgrowth of something less favorable that could be like yeast or bacteria, just an imbalance. So a kind of gentle approach is just to build up good bacteria, right? Which you could potentially do through certain probiotics, through a plant diverse diet, getting lots of different plants in the diet, and obviously getting a balanced, nutritious diet. Is that kind of what you mean by that?
Yeah, exactly. So, like feeding the microbiome with the right foods, prebiotics, probiotics, getting that protein, fats, and fiber at your meals. Variety is very important for your microbiome as well. So, starting there is super easy.
Yeah, I totally agree. It's been a great conversation. I learned a lot about eczema. Like you said, I do see a lot of people who have eczema on their list of complaints, but usually we're working on, maybe some of their more digestive symptoms, and we do see the eczema get better. But it's been great to hear from someone who focuses in eczema because I know this is a big issue for a lot of people with gut issues. So thank you so much for joining us today. And how can somebody find you if they want to learn more about your work?
So, I'm mostly on Instagram. You can find me at juliachen.rd. juliachen.ca is my website if you guys want to learn more about me there as well.
Awesome. Thank you so much.